Well, friends, it is a very special program that we have for you today because this is a very special gentleman joining us today. He goes by the name of Tim, that's his nickname. And he is, as you can see, a medical doctor. He's going to tell us a little bit about himself. And he and I have been discussing recently some of his ideas that I want you to hear as well in terms of this whole battle over abortion, about which, let me tell you, he knows a lot. And he was sharing with me some of his insights and proposals for the pro-life movement. So, Tim, a warm welcome to our program. Thanks for taking the time to join us today.
As you know, for the past 53 years, I have been an abortion doctor. And one of the more, I dare say, notorious in the United States. And that was up until about 3 months ago when I had an epiphany. And I am no longer an abortion doctor. And how that all happened is probably a better subject for another story. But it's a very interesting story. And again, I want to leave that aside because as it stands right now, that's between me and God. So what I want to talk about is that that the pro-life movement is at the most historic juncture it has ever been with this election. And the reason for that is that we have the chance to insert an amendment into the United States Constitution that will not end abortion, but will end the Planned Parenthood's killing of unborn viable fetuses. And here's the rationale behind this. Of course, the pro-life people would love an amendment to the Constitution that would eliminate abortion, but that is not going to happen. So I think we have to content ourselves with smaller victories. And the one that is within our power to achieve now through this man here holds the key to the 28th Amendment to the Constitution, which you see right here. That is, no human fetus shall be subject to abortion after the scientifically determined age of viability. Now, I know that this does not resonate with the abolitionists among you pro-life people, because people who are abolitionists are like John Brown. They want to end abortion in a single stroke, but that ain't going to happen. So we have to content ourselves with smaller victories, and that's what the Amendment 28 is. Here is the rationale for Amendment 28. Everybody knows that in 10 states in the upcoming election, abortion amendments are on the ballot. And what they plan to do is enshrine, oh, I love that word, enshrine abortion in constitutions. And what that will do, it will put that beyond the reach of legislature. Now, I firmly support the general concept. But now, what we are talking about in later term abortion, the goal, they say the one exception should be when the pregnancy is endangering the life and or mental health of the mother. Now, logic tells us it is not the fetus that's endangering the life and health of the mother, but the pregnancy, right? So why not terminate the pregnancy? Okay, I agree with them. We have to terminate the pregnancy, but with modern technology, being able to rescue and have fetuses survive as early as 20, 22 weeks, termination of pregnancy does not have to be by abortion. That's why all these abortion amendments are miswritten. They should be called termination of pregnancy amendments. And again, I say, with modern technology dealing with extreme prematurity, fetuses as early as 22 weeks can be saved. And so it is a frankly immoral thing to do, to unnecessarily, even in their own rationale, it is not necessary to kill a unborn fetus past the age of viability. Now, continuing on with the rationale behind the Amendment 28, that Donald Trump's present position on abortion is that it is a matter left to the states. Now, the reason he said that is simply because federal legislation has to do with the will of the people, certainly amendments. And the reason he said it should be left to the states is because there is such widespread disagreement on the general concept of abortion that no federal law could possibly be crafted that would truly reflect the will of the people. So, although polls have shown from time immemorial that the United States Americans are roughly divided half and half between the general concept of abortion, there is one segment, there's one small area of abortion that 100% of Americans are in agreement with. And that is that it is simply immoral to kill an unborn viable fetus. And so if 100% of Americans agree on a moral issue by the very original reason of this man, that is a fit matter for federal legislation, which is why I propose Amendment 28 to the United States Constitution, because it truly reflects the will of the people that no fetus shall be subject to abortion after the scientifically determined age of viability. And so that is my pro-life rationale. And again, I think the pro-life movement has the best opportunity with this election that it will ever in history have to get the candidates for Congress, the House and the Senate, all to ally themselves on the pro-life Amendment 28. And I am trying desperately to get through to certain key people, such as Senate candidate, Pennsylvania Senate candidate David McCormick. I emailed over and over, and also a House candidate, Mike Kelly from Pennsylvania. And all they have to do to entirely snatch the issue of abortion away from Kamala Harris and the Democrats is to stand up and indicate that the top priority of their campaigns and the top priority of their time in office will be the 28th Amendment to the United States Constitution. I just read articles this morning and said the only issue Kamala Harris has left is abortion. And we have the power to destroy them with Amendment 28. Again, I urge all congressional candidates to stand up on the very same day and say the very same thing, that the top priority of their campaign is the 28th Amendment to the Constitution of the United States. Issue. So That is my that's the pro-life side.
Well, this idea of the 28th Amendment is certainly fascinating. And you know, what I was thinking about as you were describing it was the fact that so many people, I meet them, and I wondered if you could tell us about your, you know, your own experience here. So many people I meet who are pro-choice, they would never want to see abortion made illegal or anything like that. But when it comes to viable babies, when we start talking about 23, 24 weeks into the pregnancy and beyond, they are horrified by the idea that it would be legal to kill that baby. And of course, the polling represents this. And I also think a lot of the politicians, and you're making reference to, you know, specific candidates and in this election, a lot of these politicians would feel the same way. They would feel much more emboldened to speak up against abortion in these later stages than they would, you know, pre-viability. Do you find that that's the sentiment of most people within the pro-choice community?
Actually, I don't have much contact with the people in the pro-choice community. And the reason I don't, for quite frankly, is because they're raving leftists and they're against everything I stand for. So I don't know, and I don't even care what their sentiment is. My point is simply who, no matter what their political beliefs, who could possibly oppose saving unborn viable babies? That is to say, we have to, again, let me be so bold as to point out, you went back to the question of abortion. And in this particular thing, we're not talking about abortion, Father. We're talking about termination of pregnancy. And so, because termination of pregnancy can be accomplished in the late stages without abortion, it is immoral to abort a unborn viable baby. Again, that's why the Amendment 28, and I repeat, who, no matter how rabid an abortion supporter, who could possibly oppose not killing unborn viable babies? So this is not only a wonderful pro-life advantage, it represents something that, politically speaking, the candidates could use as a weapon against their opponents, so to say. So are you telling me that you oppose the Amendment 28? In other words, you want to maintain the practice of killing unborn viable babies? No one is going to support that. So we have the advantage, we have the positive advantage of the pro-life Amendment 28, and we have the negative power it has against the Democrats.
Powerful thing for these candidates to ask their opponents about this. So let me allow you to continue to share your thoughts. You began to transition at the end of your first segment to say that this is the pro-life proposal that you have. Now talk to us about what you call the anti-abortion part of your message.
Okay. The anti-abortion arm of what I call Operation Trump Card involves this here. When I was in the military, in the special forces, they got a big kick out of my calling myself the combat gynecologist. So I thought, you know, that is the ideal character, the combat GYN, to attack abortion. And no one, I suggest, is more uniquely qualified than I, for the simple reason that until 3 months ago, I was the longest practicing, most highly experienced, and safest abortion doctor in the United States, and perhaps even the world. And so I think I probably know as much and have had as much experience in abortion as any person on earth. So I have the advantage of knowing where all the skeletons are buried, literally, in Planned Parenthood. And the way I learned that was through the tapes of David Daleiden. And I give all credit to David Daleiden for his undercover investigation in Planned Parenthood that revealed the horrible, horrible things that were going on. In fact, much more horrible than he ever believed. His fight has been against the degrading and dehumanizing trafficking in aborted fetal body parts to be sold for profit, which just in and of itself is so disgusting that it's hard for me to even believe that they're doing that. Nonetheless, they are. And as David just showed, he unearthed documents between Planned Parenthood and the University of California, San Diego, showing that Planned Parenthood actually maintains a proprietary interest in the cell lines that are developed from aborted fetal tissue. But all of that is not the incomprehensible evil of Planned Parenthood. But I'm going to tell you what the incomprehensible evil of Planned Parenthood is as to how they get that tissue. Prepare yourself for hearing some incredible things. Obviously, by definition, abortion means that the doctor has to kill the fetus, right? By definition, that's what abortion is. Now, in late-term abortion, there are two ways of killing the fetus. One way, which is practiced by many doctors, is that when the abortion starts, and just to tell people what they perhaps don't know, in a late-term abortion, it is a relatively long procedure for the reason that the cervix, which is the opening to the uterus, has to be slowly dilated to get out what is a rather large fetus. And the way that is done is by what's called the serial induction of dilating agents placed into the cervix on 1, 2, possibly even 3 days before the abortion. So many doctors, in fact, most, give the fetus an injection of digoxin, which is a heart medicine that stops the fetal heart. And that is the mechanism of fetal death for those who receive the injection. And obviously, that is a quick, merciful, and painless death. Now, the other mechanism of fetal death is to do the abortion, and I love the euphemism that Planned Parenthood has for the procedure, and this literally is what they say. The abortion was accomplished in, quote, multiple passes. And what that means, there's a great video on with Dr. Anthony Levatino testifying before Congress and telling the world exactly how it is done. And I recommend that to people because he shows that what the abortion doctor does is brutally and barbarically dismember the fetus while still alive. And as horrible as that sounds, that is not the evil of Planned Parenthood. I'm working up to it. I'm taking you through the procedure so that you can see where the true evil of Planned Parenthood is. So now the question immediately comes up, well, wait a minute, Dr. Smith, why would any doctor do the brutal sequential dismemberment of a living fetus if he could simply, and give it a barbaric, prolonged, and painful death, if he could simply, I should say she, because most of the abortion doctors at Planned Parenthood are female, if she could inject the fetus and give it a merciful, quick, and painless death. Well, here is the reason, and this is the evil of Planned Parenthood, the almost Nazi-like evil. And that is when patients come in and consent to donate their tissue, they don't give them the choice of the quick, merciful, and painless death of the fetus, because a quick, merciful, and painless death of the fetus has to be accomplished too long before the procedure. And what that means is the tissue is decomposed and is useless for research. So the Planned Parenthood doctors knowingly, consciously, and cynically withhold that information from the patient. Malpractice at least, evil at most. That they have a choice as to how their fetus dies, and do not tell them that by signing that consent, they are denying their fetus a quick, merciful, and painless death, and dooming it to a protracted, brutal, and painful death. And if there's anything on this earth that is more evil than that, I would like to know.
That is such an important insight, because, you know, when I spoke to you the first time about this and heard you explain it, I thought to myself, you know, we have people going around talking about choice, freedom of choice, and it's like, okay, so do you also get the choice of ending the life of your child? Do you get the choice of how? And what you're pointing out here is that there is a choice of how. One is painless, one is a live dismemberment. And not only does she not get the choice of how, I'm sure she doesn't even realize that there are these two different options, like you're saying. And it is no longer the interest, in other words, of that mother who wants to end her pregnancy. It's no longer her interest primarily that's being served, but the interest of Planned Parenthood then in getting those body parts. Just to clarify, doctor, medically speaking, you mentioned about the decomposing of the tissue. If the digoxin is used, okay, it's a further amount of time prior to the actual removal of that body. Is it because of the passage of time that the baby has died and the time has gone by, however many hours we're talking about, or is it because of the digoxin itself affects the tissue?
No, it's just an elementary principle in pathology that when death occurs, decomposition sets in. When death occurs by whatever mechanism, decomposition sets in. So it has nothing to do with the digoxin itself. It's the fact that the heart stop is no longer supplying tissue with blood.
Okay. And how many hours would we normally be talking about between the injection of the digoxin and then the delivery of that body?
The very least would be 8, 12, 24 hours. And in most cases, it's 48 to 72 hours. But even in a day, decomposition has advanced to the point where the tissue is useless to be sold for profit.
Okay. All right. That is very helpful. That is very helpful. Well, Tim, this is, I hope, the first of what will be many conversations, because we do want to help you get this message out. It's, first of all, it's fascinating information. It's sobering information people need to understand. And your proposal, furthermore, for the 28th Amendment to the Constitution deserves a hearing, and we will certainly do our part to bring it to the attention of the politicians and of the people within the pro-life movement. So that's all the time we have for this particular program. But I do want to have you back on. And any final words?
May I say one more thing? I think we need to have other sessions to tell the people the evil of Planned Parenthood in their practice with the abortion pill. And we also need to tell people why and how the abortion pill is not FDA approved. And the FDA and Planned Parenthood are acting in concert to defraud the American public.
Yes, I agree. We have to talk about that. That'll be an excellent further topic to discuss, because these chemical methods are very much on people's minds, very much in discussion right now, and I'm sure they'll continue to be for quite a while. And there is a lot more to be exposed here. So thanks so much for your time, for your message, and by the way, thank you for your service to our country, and thanks for your courage in bringing all of this forward. We look forward, Tim, to talking with you again very soon.